Step into any of Parkway Health's hospitals in Singapore, and you will discover that quality healthcare means more than medical care. Parkway Health offers accessibility of specialized medical procedures, quality of personalized care, and treatment at its 3 well-established hospitals: Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital. At Parkway Health, quality healthcare is about total patient's experience. It is also about tender, loving care at every touchpoint in any of its hospitals. Our reputation for excellence has not gone unnoticed. Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital are Joint Commission International accredited, demonstrating our commitment to quality, safe, and efficient patient care. Recognized worldwide as one of the leading healthcare providers, Parkway Health has a pool of experienced medical specialists, invests in medical technology, and the right infrastructure to provide value-based integrated healthcare. Parkway Health offers clinical programs that are tailored for patients to experience holistic and comprehensive care under a team of specialists. With more than 1,200 accredited specialists covering over 40 multidisciplinary specialties, patients can expect quality care and be assured of our integrated facilities and expertise, which are grounded in good clinical practice. Whether patients' needs are basic or complex, they find reassurance in Parkway Health's facilities. To achieve quality clinical outcomes and for effective treatments, Parkway Health continues to invest heavily in proven and advanced medical technologies. Parkway Health also extends round-the-clock medical service through its 24-hour accident and emergency facility, providing care for life-threatening emergencies and minor urgent care medical problems. Parkway Health operates a patient assistance center to serve as a one-stop and 24-hour service center to help patients access specialists and complex medical care in Singapore. 24 hours a day and 365 days a year, our helpline service provides medical referral and assistance in over 10 languages. Our global culture means we know and understand our patients from their perspective. People from all over the globe have come to Parkway Health's 3 hospitals in Singapore for comprehensive specialist care. Beyond its reputation for medical milestones, patients come for the peace of mind, knowing they will receive quality care by our dedicated team of nurses, doctors, and staff who understand their special needs. In realizing our vision, we seek towards achieving quality clinical service and operational outcomes. This way, when our patients step out of our hospitals, we know we have made a difference in their lives. Parkway Health, your quality healthcare provider in Singapore.
Hello viewers, welcome to Medical Information Show, Doctor's Voice. Through this show, we try to help you to lead a beautiful, healthy life. Not being sick is not healthy. You have to be healthy through proper lifestyle, taking balanced diet with exercise, something like that. Today we shall talk on cancer, gastrointestinal cancer and colorectal cancer, which is very much linked with your daily life food habits. Today we have Dr. Patricia Kho with us. She is a consultant at Parkway Cancer Center. She is a medical oncologist with subspecialty interest in breast, lung, and gastrointestinal cancers. After completing her graduation, she gathered glorious experiences in working with world-famous cancer institutes. Dr. Kho is a member of American Society of Clinical Oncology, Medical Oncology Group, Australia, International Association of Lung Cancer, Australian Lung Trials Group and Australian Gastrointestinal Trial Group. Welcome, Doctor. Welcome to your show.
Thank you for having us.
Doctor, we know about the cancer. There are varieties of cancer. But do you think nowadays gastrointestinal and colorectal cancer are increasing?
I think definitely colorectal cancer is increasing, and this could be related to, especially in the developed countries, such as America, Australia, and even Singapore. And this could be one of the related to lifestyle factors, such as food habits, a diet rich in red meats or processed food, which is very common in the developed countries, could be a potential association with the increase in incidence of colorectal cancer.
I must agree with you that developed country has a different lifestyle, but do you agree with me? Nowadays, also in the middle income countries, they are also becoming fond of fast foods and this type of red meat foods very much.
I think processed foods, even in developing country, is becoming very common. And yes, as you know, you are aware that fast food is available in all countries now. And of course, red meats as well. And not only, you know, in the older ways of preserving food, such as salted fish, cured meats, these are also have been found to be associated with increased risk of gastric cancer. And I guess also something that is associated with gastric cancer is a bacteria called Helicobacter pylori, and that is associated with usually spread through contact, through food, through poor sanitation, and of course through sharing food, which is very common among Asians.
Yeah, we Asians love to share our foods from the same utensils. How does this red meat or less fibered food act as a risk factor for the cancer? How do they?
We don't really know why red meat is a carcinogen, so to speak, but it has just been shown that in people who eat more red meat or with a diet that is richer in red meats and processed food, their risk of colorectal cancer could be slightly increased. It's not just the diet, really. The other factors in these developed countries are that people are getting more inactive, so they are physically inactive.
Especially the urbanized people.
Correct, and so that leads to obesity. And obesity and physical inactivity are also risk factors for colorectal cancer. So it's been shown that in countries where they exercise a lot, for example in Netherlands where they cycle everywhere, their incidence of colorectal cancer is going to be less than, for example, in the UK where people don't actively exercise as much. And obesity rates are also correlated to the increase in colorectal cancer.
So there are 2 points. One is food habit and another one is lifestyle.
Correct.
So how one can be alerted that I may get gastrointestinal or colorectal cancer? Is there any symptom or something which can make him alert?
Yeah, well, there are symptoms, but usually by the time the symptoms occur, it is usually at an advanced or what we call late stage. So for example, for gastric cancer, the symptoms that you may get is epigastric pain, higher abdominal. You may start vomiting. Every time you eat, you will vomit. You start losing weight. And for colorectal cancer signs, you may pass blood in your stools. Same for gastric cancers. Your stools may become black, and that's suggestive of blood. Bleeding from the stomach or from the colon.
Is it fresh blood or the blackish
Usually
one?
it's the blackish.
We call it occult,
We call it melena or blackish stools, really. Very tarry, very sticky. So that's suggestive of blood in the stools. However, we are trying to educate people, the general population, that we don't want to find cancers at the late stage, because usually when cancers are found at the late stage, then we can't cure the patient. Whereas if cancers are found at the early stage, there's always a chance of curing the patient. So one of the ways for colorectal cancer, for example, is to educate the population to go for screening, right? Screening meaning that you do tests on the patient, on the person when they have no symptoms. So they are well persons like you and myself who should undergo tests at a specific age. For colorectal cancer, the recommended age at the moment is 50. Between 45 to 50, it would be what I would recommend. And you could do either what we call a stool test, which you need to do every year. And that's a simple test whereby they look at your stool to see if there's any small amount of blood that you can't see with your eyes. All right? The other test, which is, I feel, a better test, which is called a colonoscopy, where it has to be done by a gastroenterologist or a surgeon, and they will put a tube, like a little telescope camera. Basically, they will put it through your bowel to look the entire length of your bowel to see if there's any small benign growth, which we call polyps. If they see such growths, they will remove it. And the good thing about this colonoscopy is exactly this, that they can remove these small growths called polyps, which are non-cancerous.
All at a time.
As you look, you see, you take it out. And the reason why this is useful is because these polyps, if you leave them there after 5 years or 10 years, they will become cancerous. Almost 90% to 100% of these will all become cancerous. So in a way, by doing a colonoscopy, you can, we call it a preventive method. Not just screening, it's used to prevent cancers. Because by the time the cancer bleeds and you use the stool test, it's already a formed cancer.
Some of our people, maybe in our viewers also, we have a scary feeling about this colonoscopy or even for the gastroscopy. So is it that much painful? Or
it's not painful. The surgeons will, the doctors who do it will usually put you to sleep so you can have a little rest while you do the colonoscopy. The tough part is obviously you need to clear your bowels before the colonoscopy, and that's the day, the night before. But even that now, the process is much easier, much simpler, and really there's nothing to fear.
Okay.
It's a very simple procedure.
I have one question regarding the ethnicity and the sex and also the age. Do they act like any risk factor for the colorectal and gastrointestinal cancer?
Not really. I think the age, definitely.
Yeah, you have
age
told
50
about the age,
and above,
yes.
That's the biggest age group, the most at-risk age group. Males and females are almost equally affected. In the past, people think that only males get colon cancer. That's not true. The instance is almost similar.
Both have similar. And regarding ethnicity, like Asian or...
We do find that maybe the Indians is not as common, but I think that is really because also it's very hard to get data from big countries with big Indian population. Yeah, so we're not sure.
More research is needed.
Correct, yes.
For that. With your kind permission, can we take a short break?
Sure, that would be great. Thank you.
Dear viewers, we are going for a short break. We will be right back.
The fight against cancer is often a story of hope. With hope, patients and their families have an easier time coping with cancer. And hope helps them focus on the recovery process. Parkway Cancer Center has a multidisciplinary team of medical specialists, all dedicated to meeting the specific needs of cancer patients. At PCC, we use the latest technologies in cancer treatment, so patients can access proven, innovative therapies for the best clinical outcomes. We're committed to providing the most comprehensive, holistic treatment for our patients. But more than that, we're their partners too, in their journey of hope. PCC, Singapore's leading cancer center.
Welcome back, dear viewers. Today we are talking with Dr. Patricia Kho regarding gastrointestinal and colorectal cancer. Doctor, before we went for the short break, we were talking about the screening of this type of cancers. Now come to the point of treatment. Are they curable?
As I said, early stage cancers are potentially curable, especially for colorectal cancer. So if you're talking about early stage, stage 1, whereby the cancer has not spread, then they are, the percentage rate of cure is almost as high as 90%. For gastric cancer, the percentage rate of cure is not as good. It is still, for stage 1 cancer, about 70. But when it goes to the advanced stage, then it's no longer curable, especially for gastric cancers. But with the advancement of treatments nowadays, for colorectal cancer, even when it is in the advanced stage, we still are potentially able to cure up to about 5% of patients.
Okay, doctor, as you mentioned earlier that Helicobacter pylori is one of the major causes for this type of cancer. So how can we prevent it?
Okay. Helicobacter pylori is highly associated with gastric cancer only, not colorectal cancer. And the way to prevent it, I guess, is you can't, as I said, you can't truly prevent it, and we know from studies that at least 2/3 of the world population does have it with them. One of the ways of trying to reduce it would be proper sanitation, eating properly cooked food, reduce sharing food with people that you don't know, and I think most importantly, if you have symptoms of gastritis, pain, nausea, feeling full, bloatedness, then you should go and see a doctor, and they can test for it, either by a simple breath test or what we call endoscopy. And if Helicobacter pylori is detected, we can eradicate it by giving simple antibiotics. So it's very simple, no surgery is required, and the doctor will then retest you with the breath test to make sure that it is eradicated. And so in that way, we can reduce the spread.
Okay. Regarding to that antibiotic, what are the treatment options with the drugs only? Is there
There's only drug treatment.
Okay, only drug treatment, because some of our physicians used to give so many antibiotics or so many antacids.
Right. Yeah.
So is it proper, or is it
It is
wise?
quite proper. You need to take what we call triple therapy. So you do need 3 drugs at least, and together with an anti-acid production tablet. Yeah.
Because every drug has some side effects. So some of the people may be very afraid of taking much more drugs, but we should make them confirm that no, it's safe for you and you must take
That's
this.
right, because otherwise you are putting yourself at risk of...
How long it takes if we go for the drug
regimen?
regimen?
It's a 2-week therapy.
It's only 2-week therapy. And we have heard about the tumor grafting. That is it also applicable for this gastrointestinal or
Well, tumor grafting is really applicable to all cancers. There's no delineation of which cancer you can use, and yes,
it can be used.
Yes, it can be used for.
Dear viewers, we are going to take a very short break. Don't go away. Welcome back, dear viewers. Today we are talking with Dr. Patricia Kho regarding gastrointestinal and colorectal cancer. There is no chance of recurrence, or there is chance for recurrence in gastrointestinal cancer if once cured?
There is always a chance of recurrence, because even if it's stage 1, remember I said that the chance of your cure is as high as 90%. So even in the very early stage, there is a 10% risk of the cancer coming back.
So prevention is the best way, you agree?
Of course.
And so
yeah.
we were talking about we should not take that much red meat or the processed food. So what should we take much more, like the leaves, the vegetables?
Yeah, I think a balanced diet is the most important, and of course, yes, the green vegetables, and I think, eat sensibly, nothing in excess. You can still eat red meat.
And we have to wash it properly.
Yes, you have to wash it properly, and of course, you still eat your red meats because there are some proteins in it that are useful, but at the end of the day, you need to eat a sensible and healthy diet, which is a balanced diet.
Okay, so everybody must keep in their mind that I should take a balanced diet and do the physical exercises which will keep me away from the cancers and all other non-communicable diseases.
And reduce alcohol.
Okay. Smoking is very popular in our country,
Yes.
and making so many restrictions.
Correct.
It is
And that is also a risk factor for gastrointestinal.
Smoking also?
Yes, it's not just lung cancer. Smoking
Okay.
can cause other cancers as well, like esophageal cancer, the swollen gullet, that's associated with smoking as well.
And esophageal cancer is also like the stomach
Gastric
cancer and the
cancer,
gastric
yeah.
cancer. Okay. And it's also curable with the drugs?
It is also curable, but as I said, gastric and esophageal cancer are very rarely diagnosed at the early stages because at the moment we actually don't have a screening test for it.
And regarding to the smoking, most of our ladies in our country, especially in the not a rural side, they are very much fond of chewing tobacco.
Yes.
Is it also a risk factor for this?
Yes, it is still tobacco at the end of the day. So
they
yes.
keep it in their mouth and
Yes,
they
so
chew it
it
for
is-
the long time.
Yep, so that is also a possibility.
Okay, so thank you, Doctor. Thank you very much for being with us. We have learned a lot from you regarding this type of cancers.
Thank you for having us, and hopefully it's been useful information.
Dear viewers, now we have come to the end of our show. Today we have learned a lot about esophageal, gastric and colorectal cancer. But what we have to remember, that is, we must take balanced diet, do exercise and physical work a lot more. That will keep you healthy. So please be with us and keep healthy.
This hospital will raise the bar in terms of the delivery of private healthcare standards to its highest form.
Anything you can think of, you have the best of the best working in this hospital.
Patients deserve the best of technology and the best medical care.
It's a very beautiful place.
I'm Dr. Tan Seeling. I'm the Group Chief Executive Officer and Managing Director of Parkway Pantai Limited, the holding company that built this hospital. I believe that this hospital would put Singapore on the world map. We've invested in state-of-the-art technology, medical equipment, and the entire hospital is built centered around the patient as our main focus.
I think being a patient at the hospital is really an experience for all the senses. I feel really at ease here. There are a lot of green spaces around the hospital which my family and I can relax in, and it really cheers a patient up to have sunlight streaming through the windows and you can't even feel the heat.
We believe that the healing of a patient's illness itself is a very holistic process, and we hope that this becomes an oasis of healing, an oasis of calm. So while we put in the best medical equipment, we have the best doctors and nurses taking care of the patient, we also believe in using the environment, making it a very, very comfortable, private environment for the patients to recover. The team spent no effort in scouring the world to find out what is going to be cutting edge and what is the future that's in store in terms of medicine.
The advanced technology that is available at Mount Elizabeth Novena represents what state-of-the-art medical technology. We've got a state-of-the-art operating microscope that allows us to see beyond the surgical field, and that's critical for minimally invasive keyhole surgery. We've got the ability to check our work and ensure that we get the best results possible.
Some of the cutting-edge equipment that we have ranges from imaging equipment like the Biograph MMR. We can get very clear, detailed images onto the activity of the parts in the body without the risk of course, radiation.
The list of firsts at Mount Elizabeth Novena is really impressive, and this includes some lead-lined rooms which we use for patients with thyroid cancer, and we use them to actually give them radioactive therapy. And we're actually the first private hospital in the region to have them.
We've got a platform from an IT end that allows us to retrieve information, link up information, present data.
The beauty of electronic medical records is that we can access the records from any part of the hospital, anytime, without fail. And quick access means for faster, more efficient care for our patients.
We use the pneumatic tube system to send samples to the laboratory for quick testing so that the doctors can access the results almost immediately.
The laboratory support is really impressive. Patients can actually have their blood tests taken and expect their results back in as short as 2 hours. And this means that even international patients can fly in, have the test done, and expect to be home maybe within the same day.
This all translates to shorter operating time, better clinical results, and of course we've got a brand new ICU here, thoughtfully designed, capable of looking after complex and difficult and very ill patients, and which is really what we want, because the patients deserve the best of technology and the best medical care.
There are 250 medical suites in this building, and we have specialists ranging from neurosurgery, cardiovascular, anything you can think of. We have the best of the best working in this hospital.
The clinics are actually linked to the wards on every floor, and this is really important for us because it allows us access to our patients in the wards at all times and enables us to keep a really close watch on them while they're recovering.
What's really impressive is that access to advanced medical treatment can be done within 48 hours. A simple weekend away for medical treatment is now a real possibility within my busy schedule, and that's life-changing.
The staff, they're really warm and professional, and they always greet you with a smile, and that's fantastic.
This hospital is really on top of technology, and I particularly like the other touches of technology that kind of completes the experience. There's Wi-Fi everywhere, and I can keep in touch with my family and stay online. And the patient console is a unique and nice feature that keeps everything within reach, like ordering food and of course selecting entertainment channels.
I've been a professional chef for the past 20 years. We have catered to many events and many products, but it's the first time I'm doing an opening for a hospital that position themselves 6-star. We have a cross-cultural menu that includes a symphony of cuisine and different cooking techniques as well as variety on the menu. We believe that by offering this kind of variety is sort of an excitement for the clients, that there will be something that they definitely want to look forward to for tomorrow's meal or the meal that's coming after.
No effort is spared in making sure that patient privacy, patient comfort and patient safety is not compromised in any way.
I like the garden very much, and the fountains and flowers. It's a very beautiful place.
A hospital that harmonizes the best technology with nature. It's possible.
The best of medical specialty under one roof. It's possible.
An exceptional team with extraordinary touch. It's possible.
A 5-star hospital cuisine is possible.
Care, comfort, and complete privacy. It's possible.
The hospital of tomorrow, here today. It's possible.
Service quality and speed with a human touch. It's possible.
Revolutionizing and setting a new paradigm in private healthcare. It is possible.